We're thrilled to be partnering with the whole U to be making today's session possible, and even more excited to be introducing to you today's speaker, who is Dr. Lucille Marchand. And Dr. Marchand, if my cat, this is the hazard of working from home, she's standing on your introduction, Lou, so I apologize to everyone for that. Uh, Dr. Marchand is the executive director of the UWHR Center for Integrative Medicine and is also the Farber Endowed Professor in Palliative Care Education. She is a very, very sought after speaker on communication, on the use of storytelling in medicine, in the clinician well-being, contemplative practices, and other topics such as treating pain, anxiety, and other symptoms causing distress without using drugs. Dr. Marchand has received numerous awards, and she walks her talk about health and well-being by spending as much time as she possibly can with her family, and also through yoga, hiking, writing, gardening, cooking, and singing. I think I have a lot of hobbies, but I think Dr. Marchand, you have an incredible list of activities to share. I know we are very fortunate to have you to share wisdom and stories from an entire career that is really advocating in this space of advanced care planning and compassionate palliative care. So thank you for being here today. I'm going to turn it over to you. And I know you're going to share some information with us and then invite questions from everyone who's here.
Thank you so much, Kathleen. Thank you all for being here. And this is a topic that I really like to speak about because I work in the hospital. I work with really sick patients and their caring, loving families and support systems. Sometimes it's community, sometimes it's friends. And when advanced care planning hasn't been done and someone gets really sick where they can't make decisions for themselves, be it temporary or permanently, it becomes very difficult to know what to do. And also, we all need, in all the trials and tribulations of being a human being and facing illness, usually unexpectedly at different times in our lives, we have to have advocates. And a power of attorney for healthcare is something I'm going to talk about together with other advanced care planning. But that's the person we trust the most to come with us to appointments, perhaps, to be an advocate for us when maybe we're not feeling well and in the best place to be advocates for ourselves. But particularly when we're not able anymore to make our own decisions. And of course, whenever you're able to make a decision, we ask you, not someone else. But when we are in a position where we can't make decisions for ourselves, who are going to be the people that are going to make those decisions for us with the healthcare teams that we'll be interacting with? We want that to be someone very special and who knows us really well, and a person that we can have really honest conversations with about what's most important to us. And so in palliative care, the questions that we ask are, how do you see your situation? What's most important to you? What are you worried and concerned about? And those are the kind of questions that can open up conversations that could be difficult. But really, they're such important conversations, and we have them at different levels depending on what's going on. So if we're healthy, we can go, oh, I don't have to worry about that. Let's not have that conversation. But as people start having different illnesses, they may be more open to having those conversations. But even an 18-year-old, so prior to 18, your parents or guardian are the primary decision makers, not that you don't have a voice as a child and an adolescent. But over 18, it's really important for us to be able to pick that really important person who we trust the most to be our very best advocate. Because sometimes in healthcare, our care can just be carried down a river of agendas of the healthcare team or what they think is best. But actually, our values and our preferences are at the center of that. So That's why we need to be talking to our most important people. And so when we reach the age of 18, that's the age we need a power of attorney for healthcare. And as we live our lives, that person might change over time. It may be a parent for a while, or it may be a sister or brother, or a real trusted friend. And then over time, that may change. Maybe our parents are not the person that we want to be making decisions for us. It may be a spouse, it may be a friend. And so we'll talk about that as we go along. Now, one of you sent in a beautiful story with embedded questions in it. And I wanted to read this story. And sometimes in medicine, we call it a case, but it's a story. And it brings out so many considerations around advanced care planning that I wanted to present this to you before we start talking about more of the technical aspects. My sister, and thank you so much for offering this to us. My sister was able to get my mother's advance directive set up just after mom, sorry, just after mom went into intensive care and before she was too ill to participate in her care decisions. So the timing is hugely important across the continuum of our lives. And we'll talk about that in a little bit. But it's really important to have these conversations and this advanced care planning done before it's too late. And then everybody's wondering, what would my mother or my sister have wanted in this situation? Because very difficult decisions will need to be made. And you also don't want to burden your loved ones with making decisions that problems with the desktop. Whoops. Oh, I'm so sorry. Oh, I'm so sorry. Um, Making decisions because you haven't had those conversations and they're having to grapple and feel the tension and feel guilty or feel regret or feel so many different very difficult emotions in their grief because they're not sure they made the right decisions. And you can alleviate that so much by having conversations that clarify what you would want and not want. And of course, when we're 18 and healthy, we don't know what's going to happen in our 60s. How could we? And so they have to happen with the right timing. And we'll talk about that. Back to our story. Thankfully, we had time to talk to her about her wishes before she died. Now, many years later, my sister and I are trying to make sure both my dad and his partner's papers are all in order. So there's something about papers. So legal forms that are filled out, what's most important to them is not the form, but the conversations that happen to fill out the form. Sometimes people fill out their forms at perhaps a lawyer's office, and you don't need to. All of these can be done without a lawyer. And the lawyers don't know necessarily what to talk about in terms of how to fill out these forms. And so often the forms are filled out, the legal paperwork is done, and of course, a financial will or a financial power of attorney, that has to be done with a lawyer, not in healthcare. Um, but it's more than just filling out forms. My ex-husband has incurable cancer, so I'm working with him on this. Sometimes when we are diagnosed with a very serious illness, the illusion that we're going to live forever is gone. And it's really important for that to be gone sometimes for real, authentic, deep conversation to have with our loved ones. And so I had my best friend that was diagnosed with an advanced cancer. And I can tell you our conversations were always loving and deep, but they've gotten even deeper about the meaning and purpose of our lives and how precious our relationship is and how we can be there for each other. So these are opportunities for us to fully be alive and really deepen our connections to the people we love the most. We are our own main obstacle. It said that, of course, yes. It's hard confronting the realities. The realities are serious illness is hard. And facing our mortality is hard because we're all living under the illusion most of the time that that's not going to happen. And yet that's the reality, right? Um, Ahead of both of us. So, not just for the person with the serious illness, but the loved ones that are going to be grieving the loss of that person and making maybe difficult decisions when that person is not able to make their own. I'd appreciate any tips to help us do whatever we need to do. I'll talk about that and make sure that our religious beliefs are honored when the time comes. And there are advanced care planning tools that you can use to document what would be most important before you die, at the time you die, and preparing for the next steps. And so that's really important. So that one story tells so much of why this is so important. I have no disclosures. So there's timing to all this of advanced care planning, and there are different documents that go along with that. So when we're healthy and we're over 18 years old, we need to figure out at this point in our life, who do we trust the most to be our best advocate and to help make decisions for us if we were not able to make decisions for ourselves. So I usually use the example, if you got into a car accident and you were knocked unconscious, who would make decisions for you? And there may be some tough decisions, whether or not you're going to go to surgery, whether or not you're going to have this done or that done. And so it may be your parent, it may be a good friend, it may be a sibling. So there's somebody in your life that you would trust the most. And of course, when you pick one person, other people can sort of go, oh, gee, you didn't pick me. Well, you have the opportunity to pick two other people on a power of attorney for healthcare as alternates. But as healthcare people, we need the one person to go to. It's not that the family and those people on the form don't get a chance to have their discussions and try to come up with a consensus. But a doctor, especially in an emergency situation, can't be going to 6 different people. And if you don't have a power of attorney, then you have a surrogate decision maker. And there's a hierarchy in every state for that. And I'll talk about that in a minute. When you start having multiple health problems, like you've got a bad heart, or you've had a heart attack, or you've got high blood pressure, you've got diabetes, that sort of thing, and you're getting more advanced in those illnesses, you may want to then consider whether or not you want to complete a healthcare directive. And I'll talk about that in a minute. Now, when you get a really serious illness, like you've had 3 heart attacks, you're thinking about having installation of a pump to help your heart pump. Your life is looking like it's going to be shorter because of a serious illness, or you're going through chemotherapy for an advanced cancer or whatever. Then think about adding that healthcare directive, but as together with perhaps a POLST, which is physician life-sustaining treatment. So they're orders, physician orders for life-sustaining treatment. And we'll talk about that in a minute. When you start declining in your serious illness, you're getting sicker and sicker and looking like you're getting toward the end of your life, then you definitely want to complete a POLST with your provider, your primary provider or oncologist or whoever is closest to you in the treatment of that serious illness. And then when you are terminal in the last months of your life, you absolutely want to POLST, and you really want to be bringing in, I would strongly encourage you to consider hospice. if you want to get the absolute best care at the end of your life, that will be with hospice. And because of Medicare, that's why we have the last 6 months of life, this artificial, because you could be at the end of your life for a year, you could be at the end of your life for a week. Um, Sometimes it's hard to know until the very end of your life. And so hospice has a criteria for the last 6 months, mostly because of Medicare rules and regulations. So these conversations happen. So in advanced care planning, so for healthcare people like myself, we talk about how to initiate the conversation. And I often initiate it as, well, what if you were in a car accident, and like I described before, and you had a head injury and you needed somebody to make decisions for you? Who's going to be that person? So all of us can relate to being in a car accident as opposed to, what if you get advanced cancer? It's like, oh no, I'm never going to get advanced cancer. Or what if you get like a big heart attack? Oh, I don't want to talk about that. So that's why I recommend initiating the conversation with something that is lower intensity, explaining about advanced care planning, and we'll talk about that today, so you know kind of what's the verbiage and where to go for resources, because I've had to do this with many family members as well as patients, of course, over the course of a long career. Um, and with family, I often showed them a documentary called Being Mortal that helped us begin the conversation. But that's with people that were older, maybe had more kind of illnesses already, as opposed to an 18-year-old or a 20-year-old. That's when I bring up the accident story. Identifying the healthcare agent and documenting preferences. So preferences about at the very end of life, what would you want us to do to honor your religious beliefs? Or when you get really, really sick, do you want to go into an intensive care unit and get very aggressive care? Or do you want to focus on comfort at that point? So lots of different, values and preferences we could have. So the power of attorney for healthcare, the person you trust the most to be your strongest health advocate. The two alternate decision makers can also be on the form, or none, just one. So however many, 1 to 3. Anyone over 18 can be named a power of attorney for healthcare, not finance. A lot of people get mixed up with that, but this is just for healthcare decisions. It can be a friend or a family member. It doesn't have to be your spouse. My partner would not be my best advocate in a medical situation. He would go, sure, whatever you think. That's not what I need. And he's so loving and so wonderful. But I need my best friend Meg to be there. Okay, what's going on? Give me all of the information. I know what Lou wants and doesn't want. So what you want and don't want are very important. And she would be the one that I would want to be in the room for me to get the absolute best care that's right for me or appropriate for me. So you need two, whoops, you need two witnesses of the documents, so they can't be a relative and they can't be your physician or someone working in their office unless they're unrelated to taking care of you, perhaps a receptionist or someone like that, or a notary. So in the hospital, we have notaries and they can be at the bank. So it just needs to be notarized. Make a copy for your healthcare provider so they put it in their electronic medical records so everybody can see it, as well as all of your healthcare agents, and put in the original in a secure place so that you can make more copies if you need to. But you need to have it at the right time. When you're going into a hospital, you want to make sure that you have all these forms with you. And the surrogate decision maker, there's a hierarchy of this. And this might not be the person you want making decisions for you. So if you don't have a spouse, so the spouse is the first person. And then it's, if you're an adult, it's parents. Then it's siblings. Then it's aunt and uncles and cousins, or a trusted friend. So that was a recent decision to also include people that might be important in your life that are not related to you. So these are some wonderful resources for advanced care planning, and they're beyond the form of just the power of attorney for healthcare. So that's a legal form. These forms can also be legal in different states, like honoring choices for the Pacific Northwest, but they are expanded. So it's not just who's your healthcare agent, but what are the important values and preferences that you have? What would you like to see happen in this situation or that situation or whatever? They're much more comprehensive. The Five Wishes is another wonderful document that is, if it's notarized or witnessed, it's legal in the state of Washington. And then Caring Conversations is a wonderful way of being able to figure out, how do I introduce this to my family or loved ones? How do I have this kind of conversation? So it's for you in terms of your advanced care planning and helping someone else with their advanced care planning. So all of the people that were in this story, including the author, to really figure out that advanced care planning and what's most important. And then there are some videos for decision aids in making those decisions. A living will or health directive is different than the power of attorney for healthcare. And so this is the e-form that you can look at to see what it is. It's voluntary and you have to have capacity to make these decisions. But in terms of the timing, it's usually when you start having a serious illness or concern that your serious illness might get worse or not respond to therapy. But when this is instituted, so you fill it out ahead of time of what you might want and not want. And all of these can be updated at any time. And I suggest that they be updated when things change. So my best friend, who's my power of attorney, now has advanced cancer. In maybe a year from now, she might not be able to be my power of attorney. So I have to choose someone different. Sometimes it's hard to know what you're going to want if you are in a terminal condition or permanent unconscious condition. So these are the only two situations where someone would use the health directive. And so these are the categories of whether or not you'd want artificial nutrition, artificial hydration, artificial respiration. So artificial respiration is being on a ventilator. So all of these, when you are in terminal or a persistent unconscious state, we used to call this vegetative state or persistent vegetative state. We don't use those terms anymore. These might not be helpful. You may, artificial nutrition and hydration may make you feel a lot worse. But then there are some religious beliefs that may be contrary, so that people may want artificial nutrition and hydration. As a palliative care physician, I wouldn't generally recommend artificial nutrition, hydration, respiration if somebody's terminal or in a persistent unconscious state. But that really is the decision of the person. And so if they have strong feelings about that, they may want to document that. And the reverse is true. If I was filling it out, I would not want artificial nutrition, hydration, respiration, CPR, surgery to keep me alive or prolong my life in a terminal or persistent unconscious state. I don't want dialysis at that point. So it doesn't mean that I wouldn't want dialysis at a different place in my serious illness, but at the very end of my life, or if I'm permanently unconscious, no, I don't want this. So this is the kind of things to talk about, if you have a serious illness that is getting worse. So there are special resources for advanced care planning if you have mental illness, because sometimes if you have mental illness and you are, you have a change in your status and you do not have capacity to make decisions for yourself. Let's say you are psychotic, if you are schizophrenic, you may want to have advanced directives of, if I'm in that situation, what would I want done? So that's a special situation. And then advanced directives for patients with dementia, that you may want to make these decisions very early when you're first diagnosed with dementia, because you may not make be able to make decisions for yourself if you become moderately or severely demented. Um, so those resources are very important if you have a loved one or you yourself need to access these important resources. A post is usually when somebody is at the very end of their life, maybe the last year of their life. These are physician orders. So they're not advanced care directives that you witness or you get notarized like the others. This is a physician or a provider, a licensed provider, having a conversation with you about what you may want in the last year of your life and whether or not you want resuscitation if your heart should stop, because if it's due to death, it's likely not to get restarted. This is most effective when you have a heart attack or it's during surgery or whatever. Medical interventions, whether you want full treatment or want to go to the ICU for that, or selective treatment of treating the medical conditions, but avoiding, the very intensive, aggressive care, or comfort focused care of wanting to stay out of the hospital and really maximizing comfort. And that's often done with hospice care. Antibiotic use, and these last two are probably going to be off the future forms, but not just yet. But whether or not you would want antibiotics to prolong your life or just use for comfort, like if you had a urinary tract infection, it was causing you pain and you wanted antibiotics to relieve that pain. Medically assisted nutrition is like a tube feeding. And so whether or not you would want that to happen or just, we never restrict oral intake, so of fluids or food in the dying process. This is medically assisted nutrition is generally a feeding tube or IV nutrition. And that's not often medically indicated when somebody is terminal, but those are particular decisions that are made with that provider. These are wonderful, good resources to start the conversation and for you to have a sense. They're very well written, they're easy to read, and so helpful to me. I've given countless copies of this to my loved ones. Atul Gawande, Being Mortal. And I also have a link to the documentary if somebody's not so interested in reading to start the conversation. And this is what I do with my own relatives. And then Life After the Diagnosis, written by Dr. Steve Panelat, is absolutely just so helpful, practical, practical, practical. Thank you for your attention. And I thought I had the resources to those YouTube videos, but oh, I know I couldn't do that. So go to YouTube, and the documentary that was done on PBS is there for Being Mortal. So highly recommend you check that out. I can't even remember if it's an hour or two. It goes by so fast. It's just fantastic.
Thank you so much, Lou. And we've already put a link to that in the chat for anyone who's interested, and we'll send that in a follow-up email so everyone can access it easily.
Great.
Thank you.
And if you want, because my slides, I have all the activated links. So if you could put that kind of in a document so people can access as well, that would be great.
Wonderful. We can definitely do that.
Okay.
That's perfect. So thank you. I know I learned so much and I'm still digesting some of what you shared. I hope many folks here will share some questions or maybe some scenarios in the chat. I know a few questions that have come up already. One is, I think, a little lingering confusion about how the pulsed and the living will are similar to and different from one another, because it seems like they're asking some similar questions about what decisions we want made in the same scenario. So can you clarify a little bit more how they're different when one is used and when the other is used?
Yeah, so the health directive used to be only about artificial hydration and feeding. And it was so it was so difficult to use because people would do this in maybe a lawyer's office or whatever and not talk to anybody about what this means. So if you are thinking about doing a health directive, I highly recommend that you do it with a healthcare person. But the difference between a post and the health directive is you could do the health directive on your own and just get it witnessed or notarized and never have a conversation with your healthcare people, your healthcare team. Whereas a post can only be done by a provider on your healthcare team. And so it sort of bakes in that conversation of what is most appropriate for you. Whereas this health directive can be sort of done without any guidance or consultation with someone who knows your situation and could help you. So I would recommend that if you are thinking about a healthcare directive, that or living will, is that you do that with a healthcare person on your healthcare team and not just by yourself or with other people in your family, or bringing your family with you to that appointment to talk about advanced care planning. And so that's what I would recommend. That's a really excellent question. But you see, one is done only because it's a physician order.
Yeah.
It can only be done with a physician, and these are physician orders. So if EMT comes to your door, they have to go by those physician orders. Whereas an advanced directive, they can't tell whether you're in a terminal or persistent or unconscious state. So they'll like bring you to the office or the ER. I mean, um, whereas if the post, and usually it's on a green form, so in most people, it's recommended they put it on their refrigerator. So if something happens in their home and they have that on the refrigerator, the EMTs will look at it to know what has the physician ordered that is done with you, what you would have wanted to happen. And so a physician order is different than a healthcare directive. Is not a physician order. It's you deciding what you would want and not want. But I think done in consultation with your healthcare team or your trusted provider is going to be much more important and appropriate, because I've seen these directives be in charts and it doesn't make any sense. And I go to the person and go, why did you choose this? And they'll go, I don't know. I thought maybe I should have dialysis if I'm terminal. And well, what would your goal be? Well, I don't know. I thought, shouldn't everybody have dialysis to the very end of their life? Or, so you need a conversation. And that's why the health directive has always made me very uneasy as a physician and a palliative care physician, because it doesn't always reflect, if the person had full information, what they would really want and not want.
Oh, that is so helpful. You mentioned during your presentation that some of these forms, the ones that we can do on our own or with our loved ones and have notarized, are available online.
Mhm.
Are they included in the links that you have in your slides already, or are they something we can arrange? Okay, I just want to make sure that everyone has the ability to access those. We've
I,
got everyone covered.
I
Okay.
wanted as much information that you could just press on a link to go directly to that to get what you need, rather than be frustrated looking for it yourself.
Thank you.
But I didn't know about the YouTube video, if it was okay for me to put that in on a slide. So that's why I ended up deciding not to. And then I forgot that I had decided not to.
Thank you. Um, one more clarifying question about the pulse, and then I have a question from someone that really changes direction a little bit. A question about the pulse is, as people are becoming more familiar with electronic medical records that follow me as a patient, no matter where I'm getting care, and all of my different doctors and different clinics can access them, is something like a pulse, once I've completed it, in a medical record? From what you shared, I don't think that's the case. It is. Okay, that was a
Yes.
question. So can you speak to
And
that?
and that's why when you fill out one of these, you need to bring it to your doctor's office so that it can be uploaded to your electronic medical record. And there is a spot for advanced directives and advanced care planning. And a lot of systems use the Epic system, so it makes it really easy to do that and access your directives, your advanced care planning. So, yes, but you have to be the one often to initiate that. So, if you would do a post in the hospital with someone like me, I would take that post. We would put it into the electronic medical record, make a couple of copies for you, but give you the original, which is bright green to put on your refrigerator. And it's got all the right signatures on it. So it has my signature, it has the date, it has where you can locate me if anybody has questions about that post. And it also has your signature on it. So a lot of these forms are forms that are witnessed, but they don't necessarily need your signature, whereas the post needs your signature. The others need two witnesses or a notary. And a notary, just go to the bank. Your bank, usually there's almost every teller is a notary.
Thank you. Um, a question's been asked about religion. And I think the story you shared at the beginning that someone sent before today's question, they shared their family's faith and said, we're curious about any advice for talking with healthcare providers about end of life decisions when faith can be an important part of the way people want to think about end of life care. And it's not necessarily easy to talk about if we don't know our provider really well, or it feels like an awkward space. So can you speak a little to that and provide some advice?
Yes. So if you are in the hospital and you have there's a palliative care consultation, for sure we will talk to you about that because we take care of the whole person, and spiritual aspects and religious beliefs are very important to the whole person. So, and we will work very hard to kind of honor that. Hospices are also that way. They're very tuned into the spiritual. And so if there are any particular spiritual religious practices that are really important to be done before the person dies, as the person is dying, after the person has died. So there may be some religious beliefs about the body being there for 3 days and untouched, as opposed to whisked off to kind of a funeral home. And then for some people, someone has to, be buried by sunset. And there are different prayers to be said and whatnot. So we try to accommodate that as much as we can in any hospital. So all hospitals have spiritual care. I mean, I would just be shocked if a hospital didn't have spiritual care. But even asking a nurse, saying this is really important to me, often they will relay it to the healthcare team that's taking care of you. Or as they're seeing you and they do rounding every day and go, there's something I want to talk to you about. I have some values. So if you wanted a kind of like neutral language, and I have some preferences that are really important to me that I need to communicate to you as a team so that you can best take care of me. And I can't think of any healthcare person I've ever met who would go, well, you're talking to the wrong people. Or no, um, or they may go, do you want a referral to our spiritual care clinicians here? And that would be wonderful too. But you might want to let them know what is important to you. And I think it's really important to be your best advocate and to speak up. So if anybody has an example where it was more difficult, I'd love to maybe have somebody kind of comment on that. I don't know if there's a raising of hand or whatever, but
I am scanning to see if anyone is unmuting or raising their hand, and I don't see anyone doing that yet, but that doesn't mean it won't happen. Um, I think what I appreciate about what you shared, Lou, is these are such hard conversations to have anyway. And if we're fearful that someone isn't going to respect some of our closest values or we can't introduce them, then I think that just de-escalates a lot of anxiety to hear you explain how healthcare providers expect that in these conversations. And it's not only okay, it's valued. And so I think that really reduces the anxiety level about that. So thank you.
Right. And in most, clinicians, that might not be on the top of their list of things to ask you about. But if it's important to you, they want to hear that.
Mhm. Great. Someone has asked a question. Can you say a little bit more about accessing hospice care? How does it work to get hospice?
Basically, calling them up. And so, if you were in the hospital, of course, a referral would be made by our social worker to hospice. We have hospice liaison social workers and nurses that, other than during COVID-19 time, were in our hospital. And so if you were interested in talking to somebody about, well, what is this hospice, sort of an educational kind of session, they would be right there to talk to you about it and see if you or a loved one met criteria for hospice, because there are criteria that need to be met for hospice, like you have to be in the last 6 months of your life. And generally, with most illnesses, there are certain markers that you are at this point. And so they assess that. And even if you live beyond 6 months, that's great. And so many people graduate from hospice, what we used to, because often when people get hospice care, they live longer than expected because they're getting such excellent care and good symptom control. And hospices will always be very sensitive to spiritual needs and emotional and psychological needs as well. In terms of an outpatient setting, you're talking to your doctor or nurse practitioner, PA, and or naturopath, and saying, I'm really worried that I feel like I'm getting worse, and I may be getting closer to the end of my life, and I'd like to know more about hospice. They can put in a referral as well. But and in a nursing home is the same. A social worker will put in a referral. Hospice is often delivered in a nursing facility or assisted facility or wherever you are. Hospice can be there. And then if there's a particular hospice that is local to you or you've heard good things about, and you're wondering when's the right time to have hospice, call them. And they have an intake person. And if you need education about it or assessment, they can do that. And that's like not charged or anything like that. And for most insurance companies and Medicare, and most insurance companies go by what Medicare, but hospice is a completely covered um, uh, in, intervention or program, or I don't know, I'm not getting the right word, but hospice is covered
Okay.
by Medicare and whatnot. So if there is a need for an assessment, then they can do that as well. And they sort of explain all the different resources that they have. So they have nurses, they have 24/7 coverage where they can come out to your house if there's a crisis, but really guide you a lot over the phone. They have a social worker, a chaplain. So it's very comprehensive care, but you have people who know exactly what to do at end of life to make sure that you are living fully to the very end of your life. And
We have, oh, I'm sorry to cut. We have so many questions coming in, and I want to make sure one of them picks up on what you're saying now, and I just want to inject it. So I apologize for interrupting you, but the timing seems great for the question that was raised. Someone shared a link to a recent article about hospice abuse and fraud, and had wondered if you can speak to things that someone should look for when they're looking for hospice support to
uh,
keep their family member, their loved one's best interests in mind and protect from any abuse.
yeah, so I don't want to get into any sort of big controversial area. So please give me some sort of space and grace around my answer. Before, hospices first were completely voluntary situations, which wasn't sustainable. It had to become a part of what was uh, able to be accessed for anyone, not just a particular town that had a hospice, and then, of course, most of the state not having hospice services. And So to be able to have more people have access to hospices, there were, different legislation and whatnot, and Medicare rules and regulations to make it accessible to more people. And insurance companies started making it accessible to more people, and Medicaid, of course, and that sort of thing. Now, it used to be in the old days, because I've been doing this for a very long time, that just about all hospices were nonprofit. So they didn't see their services as like trying to make a profit, because really, when you look at hospice, it's often a shoestring. And so how to make hospice sustainable on, small, what do they call margins, was really tough. And a lot of people that worked at hospice were volunteer. I was a volunteer hospice medical director for a long time before I became a little bit paid hospice medical director. But now, it's more kind of mainstream. Just like nursing home in the 60s and 70s, it's now a for-profit sort of situation. So there are many nonprofit hospices that aren't concerned about making a profit. And then there are for-profit hospices that absolutely want to make a profit. I'm not saying that the nonprofits are golden and they don't do fraud, blah, 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 and the profits sort of do. But, wherever capitalism comes in, and here I work for a for-profit hospital, so there's always possibility, and these agencies have to be very vigilant for that. And the government has regulatory bodies to really make sure that nobody is doing that. So I would say overwhelmingly that hospice is excellent, and I would trust their services. And we in the Seattle area are blessed with so many amazing hospices. So without, and I'm not financially tied to kind of anyone, and I don't want to give you kind of any sort of preference, because I think we have wonderful hospice care in the Seattle area and many parts of the country. Wonderful hospice care, but it's getting a little bit spottier, it seems, than it was before.
Thank you. That is really helpful. We have several questions, and I just want those of you who have asked questions we might not get to during our time together to know that I will work with Lou and others to try to address them and send them in follow-up. So if we don't address you specifically, it isn't that I haven't seen you and don't value the question. We may just run out of time, but we will definitely follow up.
Right. And also, I highly recommend you go to the resources, because so many of your questions are going to be answered there. So, we welcome your questions and want to be able to address them, but the resources, check them out. That they're just a wealth of information.
Yeah. One thing that you didn't mention specifically, being a part of any of the documents that you introduced today, is whether they ask about preference for body donation. And so is there
Oh,
any connection between
yes.
someone's wishes to have their body used for research that is a part of this decision-making or the directives?
Right. So donation is on your license. So nobody, almost everybody's got their license on them. And there's something about whether you want donation. But if you want to be more specific about donation, yes, there is a place on the power of attorney for healthcare. And you could put it on any of your advanced directives, but there's generally, like honoring choices and 5 wishes, there's going to be a spot for what you feel comfortable with in terms of donation.
Great, thank
In
you.
terms of body donation, that's more complicated. And, like for body donation to a medical school,
Mhm.
and you have to make preparations way ahead of time for that sort of thing to happen. But everybody is very grateful, including all the transplant people that I take care of here, who have a life because someone donated their organs.
Wow.
So
Yeah, I think many of us may have friends or family members who are alive because of organ donation. So I will echo that. And your comment about the difference between donating your body for research versus organ donation is really helpful. And it may be a great topic for us to cover through some of our outreach in the future. we have such expertise at UW. Someone asked a question about if your current healthcare provider doesn't support death with dignity, what would be the process for implementing that?
Wow, that's a good question. A lot of people aren't comfortable with this. There are a lot of things that we do in healthcare that are just make people feel real uneasy. So it's not that your provider, of course, isn't excellent and wonderful, but they can refer you to someone who is comfortable with death with dignity. And so there's a website. I'm sorry, I didn't put it in my resources. End of Life Washington, I believe it's called. It used to be called Compassionate Choices, and they will give you all the information you need to get connected to the right people in terms of death with dignity. And also, death with dignity is only in a bunch of states, including our own, but not necessarily in other states around the country. So Oregon, California, and there are a few others I can't remember off the top of my head, but it's not everywhere.
Okay. Thank you. We put a link to End of Life Washington in the chat. And again, we'll send that in the follow-up information as well. We are very close to our end time. And Lou, are there any last minute thoughts that you want to share as you reflect upon what's come up during today's session, or things that may not have come up yet that you want to make sure you mention?
Yeah, well, as you can see, just one presentation on this, a lot of information to throw at you. And it's like, oh, so go to the resources when you have a chance, read Being Mortal or look at the documentary, have these kind of conversations, but use the resources to educate yourself about this, because it's hard to have a conversation when you go, you really should do a power of attorney. And I'm not quite sure kind of exactly what it says or what it has on it, or like what. So really, kind of do your homework. And I've given you lots of resources to get started kind of on that homework. And that will make you so much more confident and comfortable in having these conversations. So for me, yeah, I'm a palliative care doc, so it's kind of easier for me to have these conversations. Uh, just one thing in my family, my sister had brain surgery, and she had her daughter and her husband as the power of attorney. And this was during COVID time. Nobody can visit. I can't go to Rhode Island to make sure that she's okay. I'm in Seattle. And oh my God, her daughter and her husband cannot make decisions for her. They're not medically kind of savvy. And it became so clear to me, Lynn, you need to have somebody else as your power of attorney. Who do you trust the most to be your strongest advocate? And at that point, she goes, absolutely you, because she didn't know that she could possibly, and even though she's having brain surgery, she didn't realize that she could be in a situation where she couldn't make her own decisions. And luckily I was, I had a really good relationship with my niece and my brother-in-law, so I could help them along. But for the future, it was really important that, and not that I'm tooting my own horn like, oh, I'm the best power of attorney for anybody. No, I'm not volunteering myself for too many people. But in that situation, it became so clear to me, and it was very, very clear to her who she needed as a power of attorney. So that is the one thing, if I can send you out, please, please get this form completed. Have at least your power of attorney completely sort of done, and make sure that you get it in your electronic medical record so everybody can see that. And you can update that and change that at any time. So all of these things are fluid. They can be updated at any time. It's up to you. Every choice is really up to you, but nobody's going to know what you would have chosen in any particular situation if you don't document it. And all of these, like the 5 wishes and honoring choices, they're wonderful tools to be able to go through a conversation and document these most important things.
Yeah. Thank you. I have hosted many of these webinars for the Whole You and for Work Life. And this is the first one where there's been a homework assignment. So thank you for that. And I think it's an incredibly important homework assignment. The information you shared will make it much easier to complete in some ways, and hopefully will help all of us feel just more empowered to have the conversations that, again, are so important and a little challenging for sure. So thank you, Lou. Thank you to everyone who has
Thank you,
participated.
everyone. Yes, thank you so much for being here.
You will receive, in addition to the slides and the information that's been shared in the chat, the whole U will send you an evaluation for today's session. And we do take that information very seriously. And so please share your feedback, and we hopefully will see you in the Zoom room and maybe sometime soon at a session on campus. Take good care, everybody.
Bye-bye.